what we have learned in medicine, and like many doctors who are very well trained in best medical schools in the world, we are taught medicine in a particular way. Even though, you have, a simple example is diabetes. You go to 10 different doctors, you get 10 different medications for the same disease.
Yes.
Why is that? Medicine, the practice of medicine was understood by the population and by the doctors and by the dentists as a science and as an art. So as a science, most of the doctors in the world are trained in the same way. We go to the medical schools, we read the same books, the science is same. However, the practice aspect of the medicine is really an art. An art cannot be universal. So the doctors do differ in their approach differently to the same disease. So there's nothing wrong. It is, if you have good odds of practicing medicine, you will be more successful in managing those diseases. Otherwise, you may not be as successful as the other doctors. That's the only difference between the doctors, why some of them are successful, some of them are not, in terms of patient types, not like really in terms of science, they do the same thing. So when I was looking at it, we went to medical school, we have learned. What did we learn? Typically in 6 years or 5 years of medical school, we go, we read the symptoms of a disease. All the books say you go to open the page on diseases, say diabetes mellitus. It's amazing how we start medicine. So I'm starting already, open that book, says diabetes mellitus, which is a disease. Which we are already talking about a disease, learning about a disease, but we are not learning about anything before the disease actually happened. That's how we are trained.
He was trying to tell that's preventiveness, early prevention.
Yes.
So not to get into the situation.
We will make sure that we really go in detail about how to actually reverse some of these diseases and prevent these diseases. But what we have learned is, identify symptoms and do some tests and make a diagnosis or name a disease for your symptoms. And when I have prescriptions for that particular disease, I will write a prescription and I'll ask you, come back next year, we will do these tests again, see where you are. That is the routine things we have been doing for more than 50 to 75 years. For the same disease, the doctor, for many, many reasons, had no time why a particular person or the patient on that day did get into diabetes. We were not trained to find those things out in the medical schools. So the diseases continue. So then I thought, is there something else in medicine that we can go through or add to the training that we have already to go towards identifying the causes of diseases? And if you identify the causes, of course, you should be able to treat the cause
in early stages until before you actually you get a disease. So I looked into, what's going on in the world about what they used to call this an alternate medicine. In 1994, NIH, the National Institutes of Health, which is probably the biggest medical research organization of the Department of United States in Washington, D.C., has established a department for research called complementary medicine. This complementary medicine, as the word says, it is complementary to the regular medical training that the doctors has. And then various things came into complementary medicine. Everything that is not traditional medicine, that is going through regular medicine, medical schools and getting MD degrees, was considered as complementary medicine. And people at that time, early 1980s and late 1990s actually, who were considered as practicing complementary medicine was considered as quacks to a certain extent, because there was no research in that field to kind of practice the evidence-based medicine where we have been trained to practice the evidence-based medicine. For example, in 1990s, I think some of the entire world population was aware of a procedure called acupuncture. Acupuncture was an alternate medicine procedure where we did not find answers to some problems in the traditional medicine. People were going to acupuncture to get help in a way. At that time, whoever was practicing acupuncture, all those practitioners was seen as quacks at that time. However, now if you look at acupuncture in NIH research topics or the pop medicine, the world's biggest medical library that we have, you have millions of articles on evidence that acupuncture works in certain conditions by certain well-trained doctors. Something like that. There is so much advancement in the complementary medicine in the last 24 years or 25 years. As a part of that, the medical community, I am not alone in this, there are thousands of doctors thought, okay, we should do and find some alternatives to the traditional medicine. And how can we do that? So the organizations came in this country. I think the first organization, I think that it came in 1994 by Robert Klotz as the department or the organization of American College of Anti-Aging and Regenerative Medicine. That's the organization they have started. And through that organization in the last almost 30 years, they have trained, certified thousands of United States doctors and doctors in the rest of the world into the alternative medicine of anti-aging, age reversal, nutritional medicine. And that is, as that was getting popular with the regular doctors to learn something new to add to their practice, there came several other organizations. The Department of Organization of Age Management Medicine in this country. And
that is the subject we'll be discussing in the coming series.
Yes,
mainly.
The alternative medicine series we will be discussing further series, and you will know why this is going to be the most important addition to the regular medical field. And I'll give my ideas how this should actually work in future, because we can't be in continuation. There are regular medical doctors and there are alternate medical doctors, and we should not put people in a problematic area. Okay, where do they go for their health problems? So I'll give my ideas how the medical school and medical training should work in a little bit. So when this coming back to the organizations now, in the last 8 years before my retirement through emergency medicine, and I was planning to, okay, let me get trained, certified, and get some knowledge of alternate medicine. So that's how I started. I have taken several hundreds hours of courses through these organizations, and I consider myself kind, maybe an expert consultant in alternate medicine. And there are several names for this alternate medicine. Even in this country, it is confusing to patients. When I say alternate medicine, okay, what is it? When I say functional medicine, what is it? When I take complementary medicine, what is it? But to be simple, other than the traditional conventional medicine that is training all the doctors in the world, anything else can be just dubbed as alternate medicine. That includes the functional medicine, the complementary medicine, integrative medicine, chiropractic medicine, naturopathic medicine, Ayurvedic medicine, Unani medicine.
Hi JKTV audience, I am with Dr. Kilaru here, and he already told that we are going to have 10 sessions. It's the most valuable. You don't get this kind of information anywhere else. So please come back and look for our every 15 days we'll have one session, mostly 15-minute session. So you can try to make sure that you subscribe our JKTV and let your friends know, and like and share. So the most valuable information you get it from our JKTV. Subscribe, share. Thank you.
ఆసక్తికరమైన వీడియోల కోసం జేకేటీవీని మీరు సబ్స్క్రైబ్ చేయండి, లైక్ చేయండి, మీ మిత్రులతో షేర్ చేసుకోండి, మా జేకేటీవీని ప్రోత్సహించండి. ధన్యవాదాలు.